topic that is so dear to my heart and something that I have been able to study and implement and learn a lot about and learn a lot from the mentors and mentees that I have worked with. So I couldn't be more thankful to have this opportunity to speak to you and also to be able to share some valuable information, which I have learned along the way. So I have no financial disclosures. So today, what I hope you will be able to get from this talk is to be able to identify the skills and also the challenges of URiM psychologists in academic health centers. And I just want to say I'll be using the term URiM as in underrepresented in medicine. That's typically, as Dr. Obaid mentioned, I work with physicians. So I do mean underrepresented in general, and I use that the terminology. Like you to be able to list ways that faculty can increase their awareness of the URiM experience and how it poses particular challenges in academic health settings, and also to hope that you will develop some personal goals for yourself to increase mentees' job satisfaction and success in academic health centers. I think probably all of us on this call and many of us really want our underrepresented folks to succeed and advance and get into leadership and that kind of thing. And we're going to be talking a bit about some of the challenges that they face. One other thing I'll mention about the term URiM, and my talk today, I will be probably using the terminology mostly regarding cultural ethnic minorities. However, I do want to emphasize that we are underrepresented and marginalized in all different forms and fashions. And I want to be inclusive of other identities, even though, like I said, I may be mentioning mostly cultural ethnic minorities. So a little bit about my journey to get here, as Dr. Obaid mentioned, I am a faculty member in a family medicine residency, which I'm sure some people on this call are familiar with residency programs. For those of you who are not, those of us who are psychologists or mental health folks are often the only person on a faculty of, it could be any different size. So happens I work with 10 family physicians in our core faculty. And so really had to find my footing in that world all those years ago when I took this job. It's the first job I took out of graduate school. I have enjoyed it so much, feel so grateful, and learned a lot about what it's like to be a psychologist working among physicians and medical folks. So I'm also a therapist. My special teaching interest, I really love teaching family physicians how to talk to their patients, basically, counseling skills, interacting with them, behavior change, those kinds of things. Also very interested in everything in the DEIA space, as Dr. Obaid mentioned. And she graciously mentioned the two mentorship programs, which I have been able to be a part of and have some leadership role in, such as you can see that's a picture from the time I was in the behavioral science fellowship director position. So I think it's really important when you are working on your own mentorship skills to be able to reflect on the mentors in your life who have made a huge difference. And I just want to give you a quick snapshot of two of the women, two of the people who are so influential in helping me get to where I am today. On the left, Dr. Tucker, she was my dissertation chair, and I also worked on a research project with her in graduate school for almost the entire time I was there, about 4 or 5 years. And Dr. Tucker was the one who really introduced me to the whole concept of health disparities. You know, we weren't necessarily using that term back in the mid 90s, the early 90s when I was in graduate school. But we worked on an after-school program for low-income African-American children. And I really started to appreciate what those children missed out on because it wasn't available to them, such as being able to be involved in clubs and sports, being in neighborhoods that had, fresh food, grocery stores they could go to, places they could walk and ride their bikes and feel safe, and not having the capacity to afford tutoring and all those special things that really help children get ahead. So that was really the beginning of my really started to pay attention to health disparities and inequities in our society and the difference between the folks who have advantages and are able to get ahead and the folks who do not. Dr. Kosh was also my graduate school professor, and she became my lifelong mentor. And she was the one who really showed me the ropes in family medicine. You know, she learned how isolated I was in those first few years, and she was the one who connected me, suggested to me to go to conferences and join organizations. And she was such a wholeheartedly supported me. And I remember when I got that first leadership position in the Behavioral Science Fellowship, and I said, I don't know why they chose me. I feel lucky they chose me. And she said 4 words that really changed my life. She said, don't sell yourself short. And that is what you can do if you are an effective mentor to the people you work with. So defining mentorship in a way that I think is helpful for to kind of understand where my perspective on this topic. So being able to use your knowledge and skills and to help your mentees progress towards their goals. And they may come in with goals. Most likely you'll be working with them to develop those goals together. Being able to develop a reciprocal relationship. This is one of the things we've really found in our mentorship program, that you want a relationship to go back and forth, the conversation to go back and forth. Develop a sense of mutual respect, develop shared goals, really come in with a kind of humble and selfless approach as a mentor. Not that you know everything and you're going to teach, but you're going to learn with your mentee and you're going to work together with this. And yes, you're going to use your experience and your knowledge and your influence to help them get ahead. But so much of it is about being there and being a really good listener, which I get a lot of practice with that, working with physicians. I find myself encouraging the residents that I work with to talk less and listen more, and really try to connect with people. And I see a similar advice with working with mentees. And then also to promote growth in the mentor and the mentee, and that mutual sense of responsibility, accountability. I am going to be there for you as a mentor. If I say we're meeting at this time, we're going to meet at that time, and hopefully you promote that mutual growth. And so often I hear the feedback of the mentors that I've worked with, that they feel like maybe they're getting even more out of that mentor-mentee relationship than the mentee is. So really looking at it as mutually beneficial. So psychologists are everywhere in medical education. We do a lot. We get involved in the teaching, the rounds, didactics, supervising, helping I know I have residents that I work with who are doing their own counseling with their patients and want advice and support. We do a lot in our research, educational projects, developing projects, really being part of interprofessional treatment teams, be it in the hospice setting, be it in a crisis setting, those kinds of things. I know here in the residency program, I'm working together with nurses and our clerical staff and everything, really trying to, just create a better learning atmosphere. And then we also know that psychologists are really well positioned to do leadership and administrative positions. Many of us in family medicine end up being associate program directors in our residency programs, which is a wonderful thing, as much responsibility as it is, and it can be taxing. And of course, a major thing that we offer in these positions is being the person who is in charge of wellness. And that is a gift and can be very joyful, and can also be very wearying on us too. So we'll talk more about that as we move along. So as I mentioned, psychologists are well positioned to serve as leaders in academic health centers. We have our abilities and skills and background in doing research, our dedication to ethical practice and so on. Just our values and professionalism and so on, communication, interpersonal skills, the things we get more of the training in than necessarily our physician colleagues or our colleagues of other healthcare backgrounds. Our abilities, again, to do assessments, supervision, and so on, and our abilities at learning to work in the interprofessional setting, which is just more and more important in healthcare these days. So what are some of the stressors that psychologists experience in academic health centers? And again, drawing on my experience working in the world of family medicine, we often encounter stressors, the competing demands as we seek to achieve professional and academic success. And many of us, we love this academic field, and there's a lot of pressure on us for promotion and tenure. And also, I thought this was really interesting, fulfilling the triple mission: clinical service, education, and research. And that weighs a lot on us. And again, I would put on top of that just the being, oftentimes being the wellness person and how much that can tax us and take that out of us. And so we really have to be careful about watching out for burnout and taking on those extra burdens. Our physician colleagues are a little bit, more so than us, taught to tough it out, whereas we are taught more, hopefully, to kind of embrace that need for wellness and so on, and really speak about it and practice our own self-care, which can be difficult for us in these very demanding professions. So psychologists in academic health centers can sometimes experience isolation, lack of peer support. And as I mentioned, when I first came into family medicine, it was a very, very difficult road for me those first few years. You're learning your job, and then you're also learning how to work in a setting different to the one you trained in. And so many of us find this really rewarding, and at the same time, it can be very overwhelming and isolating. And as I mentioned, Dr. Kosh was so instrumental in helping me to get involved in networking and different things like that that helped to ease that. And of course, being a mentor and being able to listen to me and support me also helped. So psychologists in general in academic health settings may feel some sense of isolation or uniqueness or difference. So imagine being someone of an underrepresented background and feeling even further, noticing those differences and those unique characteristics. And, some of the things I've learned along the way about doing mentorship with underrepresented professionals is that many of us come from under-resourced backgrounds. So just as I mentioned, that after-school program I did with that young children who didn't necessarily have all the access to all the things, the capabilities that were going to make them succeed in college and so on. Many of us come from backgrounds of a lack of professional or educational legacy. Maybe you're the first generation or the second person in your school in your family to go into professions like this. You might have greater family care responsibilities. We know a lot of URiM folks have unique family situations where they're in participating in helping to raise younger members of their family or taking care of older folks in their family. Maybe financial challenges, haven't been able to get ahead, dealing with different aspects of marginalization, racism, systemic racism, aspects like that, things that are just traditions that have been passed on. It makes it difficult for us to break into certain areas, having had that lack of support. Sometimes we're interested in different things that are not necessarily the academic interests of our colleagues. We may be interested in community health and underserved populations and so on that are in our interests that you might not have as easy a time of finding other people who have similar interests to work with. And so, the part of the issue, and it's a really difficult one, and I hope that we can all embrace it, is this notion of the pipeline and realizing that, it's hard enough for underrepresented folks to get into undergraduate college and then get into graduate school and then to get into an academic health center and succeed and thrive. So just things to be aware of. And of course, your URiM mentees come from all different backgrounds. So we don't want to stereotype and assume, but we do want to be aware and think of, the things that we will want to talk to them about to help them to open up, let them know we understand, and that you're there for them to speak to. So here's just a quick case scenario. I'll go through this really briefly. So for example, Nora, from an underrepresented background, loves her job on the medical school faculty, feels respected and gratified, but there are some things that she finds really challenging. So as I mentioned, that stressor of being the only one in their profession, if you're kind of in a unique situation, being the only one of your racial background. Sometimes, a lot of us at this level in our career and so on walk into spaces and rooms where we're the only one of our background. Being the peacemaker, psychologists were called on to do that. Sometimes being asked to do that DEI work and work on certain committees or work on improving the diversity. I actually have kind of It's a funny story. I'm actually really fortunate the way it worked out. It was very difficult in the beginning, though, when I started here in my residency program. And the program director, who was Jewish, he actually said to me, I want to help, I would like you to help me to diversify the residency program. And I thought, sure. And coming from a psychology background, we had always talked about this, having a diverse class and so on. Little did I know that I would receive a lot of pushback in those first few years when I first started being a little bit more outspoken on me. I didn't know the term minority tax back then, but that's kind of what it was. So be aware that folks could be experiencing some of that. Focusing on our self-care, like I said, taking on those wellness burdens. And those of us in academic medicine and academic careers have this sense of being driven to seek promotion and tenure and so on. It can be very, very difficult and challenging. So true mentors have the ability to pick up vibes that everyone else misses from within you. And this is what I mean when I say connecting with your mentee and really being there for them and really going that extra mile to really try to understand them. So we talk about the challenges of some of our URiM mentees, as I mentioned, discrimination, marginalization, those kinds of things. We also want to think about the skills and the resilience, the persistence, the creativity that many folks have to draw upon to make it. And they are good and they have this good inside of them. And so you want to empathize with the challenges and the difficulties. And hopefully in each conversation with your mentee, you can really pump them up and talk about, their courage, their faith, their strength, their resiliency, and so on. Really important to think about that. So just always like to mention microaggressions when I talk about this. And microaggressions are generally not, people don't think they're necessarily offending somebody or putting them down or making them feel marginalized, but we know that that happens sometimes. So if you look at some of these comments, your English is great for someone who isn't from this country. Are you assuming because they're not from this country, they don't know how to speak English? You are so articulate. So looking at someone who's African American, are you assuming that I'm not articulate? So just need to be very careful with your language, the things you assume, the things that you say. I had one of our residents tell me that she was mistakenly called another name of another resident. And she said, no, that's not me. That's Dr. So-and-so. And the person who was speaking to her said, oh, the other Indian resident. And so they might feel that that is just a comment that doesn't mean anything, but to be reduced to the way you look and be stereotyped and not be, not stereotyped, but not be distinguished and just sort of lumped together, that doesn't necessarily feel great. So I think it's really important to understand how microaggressions can affect your everyday life and the everyday life of your mentees. So I mentioned the minority tax a bit, the overburden of DEI work, being asked to do a lot of that kind of work. The fear of failure or disappointment, feeling like, oh my gosh, because I'm a minority, they have their low expectations from me. I'm going to have to really excel, that kind of thing. Feeling like you represent the person from your race or your background or your culture or your gender identity, that kind of thing. Oftentimes, minorities we know take on a lot of service activities and have a lot of expectations for clinical care. And part of it is because we want to do good for our communities. So just bear in mind that your mentees may be experiencing a lot of that. I'm not going to spend a lot of time on this slide, but I do want to mention the concept of intersectionality and that you really take into consideration the varying backgrounds and uniqueness of your mentees, and that the concept of intersectionality is that these different backgrounds and uniqueness kind of can compound on each other, and people experience double and triple oppression, isolation, marginalization, and something. So definitely something to think about. So the building blocks of the mentorship relationship, I've mentioned some of these before. Hopefully you're going in expecting and being willing to set clear goals and expectations for the mentorship relationship. What is that going to look like? Coming in with a sense of authenticity and trust. And for those of you who are in cross-racial mentorship relationships, trying to understand your URiM mentee, be authentic, be honest and open. Mention what you don't know, what you don't understand. If you make a mistake or a blunder, apologize, own it, see what you can learn from it. And as I've mentioned before, mentorship is really a two-way street. So some skills to work on for effective mentorship: mutual respect, facilitate goal setting, setting goals for the mentorship relationship, also helping your mentee set goals. What do they want in a year or 2 years? Maybe they can only think 6 months ahead. Provide sponsorship. Can you help them out? Are you going to be that person who's going to be knocking doors and opening up opportunities for them? Can you find someone who can provide sponsorship for them? Use the ORS listening, and I use this a lot when I'm working with physicians. I know we have a lot of very knowledgeable mental health folks on here. I know I don't need to spend too much time on that. I will mention that a little bit in the next slide. And helping mentees with self-care, so important. We have these really burdens on us of wellness. And, you know, we go into this profession because we want to help others. And it's not until you're in the profession you realize how much that takes out of you. And so I really encourage you as mentors to be good role models for self-care. And I know that's difficult because we're also in demanding situations ourselves. So again, just really quickly, being able to use that ORS framework in working with your mentee. Open-ended questions, allowing them to open up. Affirming statements, being positive and acknowledging what they're feeling, what they're saying. Reflection, being able to say it back to them, to interpret it, to help them understand, and then summarizing, trying to bring everything together. And like I said, most people on this call, I would imagine, are quite good at all of those. So growth areas for mentors. So you want to push yourself to that level, again, particularly in those cross-racial mentorship situations. I mentioned a couple of tools that you can use: the social identity profile that is referenced in, there's a reference in my list on teaching about racism in the context of persistent health disparities. And that is a way for you to examine your background, look at the things that have gotten you where you've gone, the things that might have been a hindrance to you. It looks at the different characteristics, gender, race, socioeconomic status, that kind of thing, and just asked about, you know, which ones of these have been a help to you in your career, which may have been a hindrance, which ones do you think about the most, which ones do you get the most attention for, that kind of thing. Just helps you understand your own your self-perception and maybe how you come across in the world. And then the implicit association test. I think a lot of us know about the Harvard implicit association test. For those who don't know, it is a way to go through a questionnaire quickly and see if you have a bias in the area of, it could be gender, it could be skin tone, it could be race, it could be age. Just really, everybody I know who's done it is just so surprised, because we develop these biases as we go along. You just have to be really careful as a mentor to check your biases. I mentioned before, be a role model, and that concept of cultural humility. You know, go into the relationship just open-hearted and wanting to learn, and being able to apologize if you make a blunder and use that as a learning experience. Again, quickly mention another great tool that I've come across is the bystander upstander training. And this is a terrific article, Becoming Active Bystanders and Advocates, Teaching Medical Students to Respond to Bias in Clinical Settings. And the idea is you can be just a bystander, or you can be an active bystander, or in this particular article, they also use the term an upstander. And this refers to when you witness a microaggression, or when you witness an act of racism or something like that. What are your options on how to respond to this? And what I like about this model is it helps you think of it in terms of options. So are you going to respond directly and say something to the person who committed a microaggression against somebody right there? Are you going to delegate it? You might not be the best person to confront this person or address this issue. Is there someone else you can go talk to? Sometimes the best thing to do is to do something to distract from the situation. So let's say a senior member of staff is somewhat insulting to a trainee or your mentee. Sometimes you need to just shift the conversation in another direction for the sake of the mentee. Can you delay? Sometimes it is not the best thing for you to respond right then, or you might not be somebody who's comfortable responding right then. And then you can also display your discomfort if you want to. So what I like about the model, it gives different options. It allows you to address things right then, or if you're not that person who would address things right then, you can go back and address it another time. But I do encourage you to check out that article. Again, it's in my references. It's very, very helpful. Another nice quote, advice is like snow, the softer it falls, the longer it dwells upon, the deeper it sinks into the mind. Again, just thinking about the time you spend with your mentee. So here are some tips for those in racially discordant mentor-mentee pairs, again, working with underrepresented mentees. How do you build that relationship? So listen for an invitation to discuss oppression. They may want to talk about it, they may not want to talk about it. Listen for that invitation and try not to ignore the invitation. Try and pick up on it. Even if you don't know exactly what to say, that's fine too. You might say, I might not be the most helpful here, but I do want to hear what you're going through. Be aware of privilege presenting itself in conversation. So think about your examples you use. Maybe you come from a background where, you had previous professionals in your family and they were able to help you and so on. And just remember that given examples from your background may not match with their background. Sometimes your presence, they may have experienced difficult relationships with other folks who are of the majority culture, and just be aware of your presence and how that may affect them. Try not to fix the problem. Like I said, do a lot of listening, step back when appropriate. They may invite you into the conversation. They may say, I can't talk about this right now, or I can't talk to you about this right now. Use mistakes as a learning sessions. I've mentioned that before, but primarily these can be really uncomfortable situations. I encourage you to lean into that discomfort. Helping mentees address self-care, again, so important. Imposter syndrome, a lot of us have experienced this in academic health settings, perhaps even more so for underrepresented folks. Learning to say no and set those boundaries, and really set boundaries around those minority taxes. Addressing discrimination when they can. Not everyone can. When they can, it is their right to do so. If they don't feel comfortable or safe doing so, that's not something for you to push them. And again, if I use another terminology, it's trying to create that sense of safety between you and your mentee, that they can talk to you about anything. Help them to find allies. Dr. Kosh certainly helped me with that, helping me to connect with others. Might be people in other institutions that they can connect with. And also encourage them to take care of their spirit. Do projects that they really enjoy. Do their hobbies and their activities. Just check in with them every time. It's just so easy to ask that question. What are you doing for yourself? What are you doing for your self-care? So what is your role in mentorship for underrepresented psychologists or professionals? So there are many layers and aspects to mentorship. And again, a lot is going to happen in those first few meetings where you're setting up when are you going to be meeting, and what are your conversations are going to be about, and who's going to be setting the agenda, and so on. And so it's up to you to really develop your style as a mentor. And so you can decide what your role is going to be. Are you going to be there to support them, listen to them, be there for them to talk, have them call you whenever they need to? Are you going to take it a little further even, and to really address some of the issues that are going on with them, and be an active supporter of them, and sometimes have difficult conversations with people that they need to confront or address or something like that? Are you going to be a part of that and step forward a little bit more from your support role? Are you going to join with them? Are you going to say, you know what? Not only do I want to help you as my mentee, I think this is an important cause, and I want to work on this too. And I want to work on this in my other spaces and settings, and really helping people understand the bigger picture of what URiM folks go through in academic health settings. And are you going to take it an even step further? And are you going to embrace and champion, and separate and apart from working with your mentees or working with, junior colleagues? Are you going to take some of this on to be that person who, for instance, is going to say, if you're a head of a department or something, or talk to your department chair, I think this is really important. I think this is something we need to talk about and delve into. So a long continuum of what you can do in this area. So I really encourage you to think about setting SMART goals for yourself. So how can you possibly use something from this talk? Is there an article that you're going to go read and learn some more about? And again, the more specific your goal can be. What is your specific goal? How will you know if you attained it? Is it achievable? Is it realistic? What is your time frame? So are you going to set a goal for yourself that you are going to speak to a certain number of people or a certain department? Or are you going to find a particular resource? Are you going to take the implicit association test? And what is your end goal? And when would you want to achieve it? So again, I know I moved really quickly. Again, reflecting on our objectives, hopefully you're able to identify some of the skills and challenges of URiM psychologists in academic health settings. Hopefully you can see ways that you can increase your awareness of this, talking with them, connecting with them, looking at certain resources, and really showing that deep sense of understanding of what is going on with them. And if you don't understand, just be really open and honest and say, I would like to learn more about this. And then being able to develop your own personal goals to increase mentees' job satisfaction. And like I said, I think that's our end goal here. We want folks to enjoy their work settings. We want them to have that support to get that promotion and so on, and to go into leadership positions. We have so much to offer as psychologists when it comes to leadership positions. So a final quote, in my estimation, mentoring is a gift. We are greater than and greater for the sum of us. And those are my references.